All right, welcome everybody to It's Worth a Shot. Today we're going to be going over facility pets and infection control and then environmental assessment of vaccine access. Next slide, please. As always, we want to thank you for participating in the webinar every week. We really appreciate the attendance that we get. And we also want to thank all of our guest speakers and collaborating partners for sticking with us for all these weeks when we thought it was just going to be a 13-week process. So we really appreciate your guys' ongoing patronage. Next slide, please. All right, and as always, if you have any webinar topics or anything you would like for us to cover, go ahead and put those in chat. And then we also ask that you fill out the assessment on the webinar once it's placed into the, there we go, the evaluation once it's placed into the chat. We really appreciate that. So we're going to start off with a polling question now. Did you know that you have to offer vaccinations that residents may be eligible for annually, and annual declinations are to be on file to demonstrate these offerings if they have been refused? It's just a simple yes or no. All right, looks like the voting has slowed down. Let's go ahead and end that poll there, Mary. It looked like a majority said yes, and there's a few no's. So if you want further information about that, feel free to reach out to us and we'll make sure somebody can go over that with you. All right, next slide. All right, let me go ahead and turn it over to Kyla to go over this week's influenza snapshot.
Hi, everybody. Feeling festive today, so feel free to go on camera. This week, we're really seeing another big increase in flu positivity rates. We were at 14.7, I think, last week, and we're at 18.2% this week. So we're just seeing that number continue to climb. So please, everybody, encourage folks to get their flu vaccine. We have seen kind of a shift to a higher percentage of H1N1 strain. So 78% H3N2 and 22% H1N1. We've seen a total of 12 pediatric flu deaths. And we're also seeing just kind of this trifecta with COVID, flu, and RSV kind of spiking at the same time, or at least increasing. So we really, I encourage everybody during this holiday season to protect family and friends in your communities by getting your flu vaccine and making sure your patients have it as well. So thank you.
Okay, so we had a couple questions from last week's webinar, and unfortunately don't have the answers. Julia had to go out on survey, and so she wasn't able to pull these together before she was out of the office. So we will answer these questions on next week's It's Worth a Shot. So we haven't forgotten. These are the questions that we collected, and we will go ahead and again go over them next week. Next slide, please. All right, I want to welcome Shay. She's a new member of Mountain Pacific, and this is actually her first presentation that she's doing on IWAS for us. So let's think good thoughts for her. And Shay, you got it now.
Thanks, Miranda. Again, welcome everyone. My name is Shay Trafton, and I'm an account manager from Mountain Pacific. My background includes over about 10 years in the healthcare setting, all the way from community health to long-term care. And additionally, I am certified as a SHRM CP, so that's a Society for Human Resources and Management. So I also have background in human resources and policy and procedure implementation. So with my background, I've had the I guess, pleasure of being behind the scenes on the forefront of the dilemma with animals in the healthcare setting. So today, I will be going through some of the positive and negative aspects that surround animals in healthcare settings. Next slide, please. So currently, the debate is, do animals have a place in the healthcare setting? Animals are now becoming a common sight in the workplace, in your general workplace, and are encouraged even to be a participant in your daily work activities. However, as it pertains to the healthcare setting, the debate is still out. In the past, animals were viewed as more as a study, and you'd see those animals in a lab. Now we are seeing more of a presence in the long-term care facilities and in hospital settings, but the debate over their presence is still being analyzed, and studies have been conducted to produce various results. So what does this debate encompass? Well, the next slides will go through the pros and cons of this debate. Next slide, please. According to the 2019-2020 National Pet Owners Survey, about 85 million households, or roughly about 67%, own some kind of a pet. And studies are showing that this percentage is growing every year. So it's no wonder why we're seeing more of an increase in pets and their presence in the healthcare setting and in the workplace. But in regards to that, there are certain benefits that that these benefits include. One is in an animal-assisted activities. So these are activities or programs that enhance the patient's or resident's quality of life. These animals can attend group activities or even visit non-ambulatory residents or patients within their room. Animal-assisted therapy, this is different than activities, as it's a goal-directed intervention that incorporates an animal into the treatment process. Counselors are now even including animals in therapy sessions to help the individuals feel comfortable and to open up. Resident animals. This is where the facilities purchase an animal or animals to live at the facility. This animal is taken care of most commonly by staff or a resident. The contact with animals is considered beneficial for enhancing wellness, and especially in children, older generations, and those in an extended hospital stay. The thoughts behind the resident animal is to make the facility resemble more of a home-like environment, as well as support individuals in times of need. And reports are being conducted to correlate the connection between the mental health conditions and pets. However, studies continue to show multifaceted ways in which pets contribute to mental health conditions. Next slide, please. So despite the positive sides to having an animal in the healthcare environment, there are aspects to be considered. The American Academy of Allergy, Asthma, and Immunology estimates that dogs or cats occur in approximately 15% of the population. So minimizing contact with animal saliva, dander, and/or urine helps mitigate these allergic reactions. Some facilities may not allow animal visitations for patients with underlying asthma or known allergies to cat or dog hair, respiratory allergies of unknown, and immunosuppressive disorders. And this needs to be considered not only in residents or patients, but also with your staff. Infection control needs to be analyzed when considering a facility pet because of these certain aspects. Specifically, are you using appropriate cleaning products and establishing protocol for cleaning up the animal's feces? Outside and inside the facility need to be considered. This again could be an area of contention when assigning someone to clean up after the animal. Not everyone is willing to partake in these activities. And again, precautionary measures should be taken prior to getting an animal or allowing animals into the facility. Mainly, you should ensure pets are appropriately trained to avoid adverse events. Service animals are provided certain training to deal with behaviors and situations that would mirror settings seen in a healthcare environment or around a big group. It would be very beneficial to reach out and check with your insurance agency to allow for any additional coverage you may need in the event that there is an adverse event. Also, attachment issues could be something to consider, as residents in a long-term care facility may establish strong bonds with animals, and this could create conflict amongst amongst residents. And then as you look into a service, an animal, it may be beneficial to determine if a service animal poses a direct threat in any particular healthcare setting. This must be based on individual's assessment of the service animal, the patient or patients or residents, and the healthcare situation. When evaluating risk in such situations, healthcare personnel should consider the nature of the risk, including duration and severity, the probability that injury will occur, and whether reasonable modifications of policy, procedures, or practices will mitigate these risks. This assessment should include vaccination routines, records, and mitigation of disease transmission. Although animals potentially carry zoonotic pathogens transmissible to man, the risk is minimal with a healthy, clean, vaccinated, well-behaved, and well-trained service animal. And mostly these service animals are considered dogs or cats. And no reports have been published regarding the infectious disease that affects human originating in service dogs. So again, I would suggest that strict policies and procedures around infection control measures, such as hand hygiene and the use of cleaning products, be put in place to avoid any concerns. It should be communicated with staff prior to and consider those with allergies and if there's any precautions that need to be made. Considerations of staff is essential to a positive work environment and should be addressed prior to. So with that, in regards to infection control, perhaps an assessment tool that you can implement prior to bringing the animal into the facility would be an ICAR. And these must be undertaken to evaluate circumstances specific to providing care to animals in human health care facilities. Individual hospital policies and guidelines should be reviewed before any animal treatment is considered in such facilities. Animals treated in human healthcare facilities should be under the direct care and supervision of a licensed veterinarian. This will also should be free of known infectious diseases and other external contaminants. Next slide, please. So as this goes forward into infection control aspects regarding COVID-19, interestingly enough, animals can contract COVID-19, but the risk of an animal giving it to a human is extremely low. Still, there are more studies being conducted and surveillance is needed to fully understand the spread and the correlation between people and animals. So animals that are infected with the COVID-19 virus have been documented around the world. Most of these animals became infected after contact with people with COVID-19, including owners, caretakers, and others who were in close contact. So we don't know all of what the animals can get infected, but animals reported infected worldwide include dogs and cats and monkeys. Since the beginning of the pandemic, the CDC has been leading efforts to improve our understanding of how COVID-19 affects animals and how the virus might spread between people and animals. So again, this is a new process and it's being analyzed, and the CDC is working to improve the coordination of the federal, state, and other health partners to develop these results. So in conclusion, animals in the workplace are still a controversial topic. Though they have their benefits, it is still facility dependent as to whether you want to include an animal within your environment. The previous aspects that I pointed out need to be considered when thinking about putting an animal into your facility or allowing one to come in. So I would just be curious, and I see that Jesse had put it in the chats, but if there are people who have facility pets and how that is going for you guys. I don't see a whole lot, but it's not uncommon just because of the controversy around policy procedures and then the asthma and other allergic reactions you may have to facility animals. Though again, there are positive aspects. In our facility, we did have employees bringing in their animals, and we did have concerns, but I think the biggest concern we had were the residents providing or getting attached to these animals and became pretty dependent on them, and also kind of made sure that they didn't leave their rooms and were essentially hoarding these animals. So those are things to consider in regards to the relationships that are formed. But then also, again, the infection control aspect is another one that needs to be analyzed prior to bringing the animals on board. Does anybody have any questions? All right, and here are some resources you guys can use if you are considering having a facility animal or implementing animals into your facility for healthcare, or excuse me, mental health bonuses. And that is all I have. I believe I'll be turning it over to Jesse unless there's other questions.
Thanks, Shay. Looks like there's just a few comments. A big challenge is to keep the residents from feeding the wild chickens.
Oh goodness. Chickens aren't a hot topic, but they could be.
Yeah, and it sounds like Holly mentions they recently discussed it.
Yeah, nothing serious. Yes, and I have talked to a few other facilities that do have animals that come in, but they are just merely for like, I guess, hours at a time. They're not facility animals.
Right, just therapy dogs that visit through community
Correct.
groups.
Yeah.
Yeah, that seems to be the movement. I remember a time you walked in the front door and everyone had massive bird cages or a cat sitting on the chair at the front, and that seems to have really shifted a little bit. So yeah. Thank you, Shay.
Yeah, thank you.
Well, with that, thank you everyone for being here and allowing me to visit today. I thought I'd take a little temperature check and talk about environmental assessment of vaccine access. Next slide, please. So these numbers are reflective of about the last 10 days. We, as far as COVID-19 vaccines administered in the United States, we have about 69% of our general population that is currently fully vaccinated. And about 81% have received at least one dose, and about 44% have received a booster. So our total for United States, we are, we're leaning on the higher end of fully vaccinated when we look at other countries, but we also are on the lower end when we look at boosters given and administering the up-to-date vaccine. And I will say that just a little statistic worldwide, as of just this last week, we're at $12.99 billion doses of COVID-19 vaccine have been given. Billion. 12.99 billion doses have been administered globally of COVID-19 vaccine. I think that's pretty remarkable as we reflect on everything we've been through in a pandemic, especially in the nursing home and the long-term care setting. So again, 12.99 billion doses. And I would say about a quarter of people in low-income countries have received at least one dose of vaccine. So the impact is huge. Next slide, please. So I am going to screen share. Let's see. I want to show you, if someone would just confirm you can see my slides or my page. Should say how many vaccine doses have been administered in total.
Not yet, Jesse. You have to share your screen. There you go. It's coming up.
Okay, perfect. So there is a website, webpage. It's called ourworldindata.org, and I will drop it in the chat box for you too. This is developed by University of Oxford, and it pulls together all the vaccination data across the globe from all the countries, from all the databases, so that you can really compare the state-specific, region-specific, population-specific data and uptake. And I like data, I like looking at facts, I like looking at the numbers. So I wanted to take the opportunity to show everyone on the line today. And when you scroll down through this page to the section that's vaccine doses administered, it's really neat how they developed this little map, because you can hover over the map, see how many doses have been administered, and then compare it to neighboring countries. So you can kind of see how the United States compares maybe with some European countries. Okay. And then you can also look by population, income group, and timeline. So again, I just wanted to share it. There's some neat statistics in here. You can break it down by how many doses have been administered over time. So just a little, anyone else that likes data, again, I'll drop the link in the chat for you. All right, Mary, I'll stop sharing. All right. And next slide, please. So with that, as we kind of look back and reflect on how far we've come and where we're at, we, again, billions of doses given worldwide. And as we look at the updated vaccine or the bivalent vaccine that covers the variants that we're seeing circulating, you know, just in a short window of time that was approved. So into August, early September, that bivalent was approved for 18 years and older. Later in October, they updated some of those approvals for the younger age groups. And the importance is, since that approval time and the recommendations for when you can receive that dose being the 2-month mark, we're seeing more and more folks eligible to receive that updated vaccine as that 2-month mark is approaching. So as community members and maybe in our long-term care facilities, family, it's just a good public service announcement. You know, you may be in that eligibility window now, and it'd be perfect timing to receive that updated vaccine, especially as we reflect on that trifecta of respiratory viruses that is really swirling in our communities. And with that new variants, you know, we are starting to see data collection and effectiveness of this updated vaccine. And it's showing to be highly effective against that BA4 and that BA5 variant. You know, we've been waiting for data, waiting to see, well, is it effective? Does it work? And it is really proving to us it's doing its job to reduce severe illness and hospitalizations. So again, perfect timing for that updated vaccine or that bivalent vaccine as we hit that 2-month mark for a lot of folks. Okay, next slide, please. Vaccine access, the current picture, it's continuing to be variable depending upon the community in which we live in. And whether we're looking at community access, maybe through retail pharmacies, health departments, or provider departments, versus the long-term care picture and what that access looks like for nursing homes or assisted livings. So for example, in the community, retail pharmacies, depending upon their size, may or may not have COVID vaccine on hand, or they may be requiring appointments. So again, just information sharing as maybe we're discharge planning or surveying our opportunities to access vaccine in our community. Just know that more retail pharmacies are requiring an appointment to receive the updated vaccine. Same with health departments. They may only be consolidated down to 1 or 2 hours a week, and they may need an appointment. So being mindful of that as we encourage staff vaccination rates, that it's easy to encourage, but just to be aware of what does that access look like in our community. And of course, if you need help aligning access, feel free to drop me an email. And provider departments, more and more providers are not carrying the vaccine just because of the quantity that has to be ordered. They're not ordering it anymore. So being aware of that. Long-term care access, continue to work through those long-term care pharmacies to obtain vaccine, utilizing those mobile vaccine partners. And I will say, if you need those mobile vaccine partners, they have really assisted to organize vaccine if perhaps there's some barriers or staffing challenges in-house. So just know that those mobile clinics, they're out there. Sometimes we just need to connect them with you. So, and again, long-term care access to vaccine is requiring some long-term and pre-planning. So there's barriers still out there, and there's also some workarounds. So again, just a current picture, and let me know if you need any assistance. Next slide, please. A few vaccine update tips to share forward. Again, reminding everyone to try to normalize the COVID-19 vaccine among the rest of your vaccines. Pair those immunizations with other health interventions. So maybe, if you're doing a routine assessment or doing rounds with the provider and there's an opportunity to offer and encourage vaccine at that time, to capitalize on that. We're working to develop annual consents with multiple vaccines that would include COVID-19 vaccination. Single dose vials. This is big news, breaking news within the last 2 weeks. States are finally able to start to get single dose vials. So I think someone just added in chat about ordering less vaccines. Yes, that is finally, we're starting to see some changes in the quantity in which doses are being provided. So I don't know specifically what states are next in line, but I do know state of Washington, as of 2 weeks ago, finally got their first single dose vials. So big news, big news. Bivalent updated vaccine, again, a little bit of language. We're seeing a shift from saying bivalent to updated, just to soften that a little bit and encourage folks to receive their updated vaccine. Just a language shift. And then using clinic signage to let your staff and residents know when their next clinic may be, as a friendly reminder. Next slide, please. So again, as I'd mentioned, that updated vaccine effectiveness, we're starting to see some data come in where these updated vaccines, they're showing to be significantly more effective against those subvariants and absolutely doing their job on reducing severe illness and hospitalization and even death. Next slide, please. Progress and development. Here's a few kind of updates as we look at the environment at the moment. The nasal vaccine for COVID-19 has been approved, and they are actually using it in India and China right now. The United States is not too sure about proving it for us. There's still some discussion and debate on effectiveness, specifically when you use that nasal vaccine, how much of that vaccination is going down into the mucus and to the stomach and not necessarily aligning to work the way the mechanism of the vaccine should work. So stay tuned there, but it is being used in other countries officially now. Also, update on Pfizer and Moderna. They have announced trials and are currently underway to assess the safety and efficacy of a dual vaccine with flu and COVID-19. So again, the trials are now underway to see if this is going to be something that's feasible to potentially have on the market by next year. And there are some barriers, though, with some of the variants shifting, as far as being able to predict the effectiveness. So they're working through that. But again, that's an update though. Finally went to trial. So we'll see what happens next year. Next slide, please. And here's just a few resources that speak to that nasal vaccine, some articles, a podcast, and then the dual vaccine flu COVID trial information. And it looks like in chat.
Yeah, there's one question, Jesse. It's from Holly.
Okay.
I believe she had to hop off to go to a meeting, but her question was, is the booster stat based on the fully vaccinated stats, not the whole population?
Yeah, good question. So that 44% is currently our long-term care community is 65 years and older. Only 44% of that population have received a up-to-date vaccine, the bivalent. So it's much less than expected. And then I see Kathy asked, about ordering less vaccines, so volume. And she mentions that, Kathy, what state are you in? Just out of curiosity. Montana. Okay, good. I didn't know if we got them yet, so thank you. You're the first to tell me. She says she got the single doses, but still had to order 50. Okay, that's good to know. Kathy, since I have you there, what's the expiration on those? Out of curiosity, you know? It's okay. It's okay. I'm just curious. Well, once again, thank you, everybody. Don't forget to complete the evaluation in the chat box if you have a few extra moments. As always, thanks for taking the time out of your week to join us. We hope that we're bringing you relevant information. And same time, same place next week, and wishing everyone well.